When I failed in standard 7, I then moved to my uncle's house. My uncle then had, or my auntie was my mother's sister. They had 5 children with my sister, my elder sister, staying with her. And I'm staying with her as well. And that is 7 children in a 2-bedroom house. So my auntie them occupied and my uncle occupied the 1-bedroom. All of us had to stay in the 1-bedroom. And I always reflect on it. There were 2 double bunks. Now, double bunks is 1 bed at the bottom and another bed on top. I would then wake up in the middle of the night, and you won't believe it. I'm still, if I want to be at the best mentally and intellectually, I then need to work through the night. So that is how I obtained my matric certificate, by being able to sleep during the day, studied every single night. So those are the type of things that shaped my life. But it also didn't shape my life materially. It also shaped my life in terms of my own morals, in terms of my outlook in life. I then changed and I went to go into nursing. And most of the patients were farm workers. And the manner that the patients were treated, that was the one thing. But the other thing that struck me at Tygerberg was that Tygerberg, and that's why it's so difficult for government to manage Tygerberg Hospital at the moment. Tygerberg Hospital was built as 2 solid hospitals in one. So what you get on the one side, if you get a cardiology unit at the one side, you get it exactly the same at the other side. But we as black nurses could never go to the white side of Tygerberg. It was the west and the east, where we were with the east. Our hostels was exactly the same, but we could never mix. What was interesting, if you're on night duty and there was a shortage of nurses on the west side, which was the white side, then we will have to go on that side. But there were few wards we couldn't work in. We couldn't work in pediatrics, and neither could we work in gynecology. But if you work on the west side, when it's tea time and lunchtime, now this is during the night, we could only work at night. During the day, you don't find a black nurse. Now, I unfortunately have to use racial terms. An African black person who wants to study nursing could never study in the Western Cape. There wasn't a college for them. That came very late, what you are seeing now. Neither could a black African nurse work at a public hospital. The only hospitals they could work at was St. Monica's. So that was my first awakening, was that separation, but it was also the way patients were treated, and especially patients from farming community. We start because YCS was a non-racial student organization. So we obviously worked with whites, blacks, and coloreds. So most of the UCT, or some of the UCT students, some of the WIT students, we were all working together. And through that movement, we started to reflect on what's going on in the country. Because YCS had a theory, and I, throughout my years, I'm retired now, just recently retired, but even in my professional life, I used it. It was called C Judge Act. Come 1980, I was then very involved in the 1980 student uprising. One of my responsibilities that I had as an activist was in the student movement, was to organize, but also because at that point now you're educated, so you would take the minutes, etc. But I could also drive. So I would drive even the elderly, like your Melesia and other persons. We would mobilize outside of outside of Cape Town. So that's in the student movement. Then I became involved in the youth movement in Hanover Park. So we established a youth. We established then what is called the civic organization. So now from just being at YCS, I then started to branch off and do all the other things that I was doing. So we started a youth movement, and we started to mobilize the youth in Hanover Park. Now, when we were doing that, we then did not just, we did political education, we did literacy, you won't believe it. Through literacy, we had a book club. We also established a creche in Hanover Park. One of our youth members was a social worker working for child welfare, and we then established a fully fledged creche. And me, with my health background, I was involved in that. Post my youth years, so we then trained ordinary people in teaching other people healthcare. Because at the time, the health system for the black was zero. The health system for colored was also very poor. So we trained them in basic stuff to do. The salt and sugar solution that you hear now people are talking about, that was what came from me and Ivan at the time when we trained. So what I then did, I then was a fully fledged nurse. So what I then did is through nursing, it was fire in the Western Cape. So I was involved in UCO, I was involved in the civics, I was recruited for the underground movement as well. But what it then did with the underground movement, because I was a nurse, I would use my nursing uniform, my epaulets. I would then travel from, if things has to be moved, and I have to say to you, even if ammunition has to be moved, I would then move it, because at that time, I had transport. I would then move that. At one night, we moved from here, we went to Paarl to go and deliver, we're going to deliver ANC's ammunition there. I've got stopped at the ball because what they did, they had lots of roadblocks. We formed first the concerned nursing group, where we mobilized nurses. So remember that what we've done at that time, if you are connected in education, then you will go and organize there. If you are connected with the workers, you will organize there. So most of my political organization was to organize nurses and doctors. So I left to make my contribution outside of nursing. And today I can say to you, I'm very proud, because if you interviewed anyone and they tell you that how the parade looked when Mandela was released, that I was in charge of the health part of that section. Those mobile clinics that was there, I've organized those mobile clinics. But I was in the same room with Mandela at the time. When Mandela walked in, I was there in my health capacity, so that in case something happened there, me and Leslie, them, which is the doctors, we would be able to attend to it immediately because there were masses of people. So they were very, from the contribution that I've made, some of the things are still in existence. But the thing about women, whenever there was a need, women will come out in their masses. And that was very interesting. When there was any house that something happened, you would find women storming there. If I get arrested, remember we didn't have cell phones. We wouldn't use landlines because our landlines were tapped. We wouldn't sit in one venue and meet there all the time because we never knew who is working for the system. So they used to bug the room, the spaces where we are. So in terms so women were very united. We cared for each other at that time. And care, not just say, how are you? We cared in many ways for each other. And those was ordinary women. It wasn't, at that time, we were few professionals, which was very, very active in the struggle. So the majority was ordinary women. But I can also say to you that with the women's movement touches on the softer, apart from our political direction. We were trying to stabilize the softer part of it. We looked at health, we look at education, we look at the elderly. We used to have soup kitchens for the elderly. We used to go and visit the elderly. We used to get a groupie together and go and visit auntie this and auntie. So we always used to go and visit. But what we've also done is that for us, which had a solid income, we would then look and start adopting a family. We would adopt a family and we would sometimes just go there, give them groceries, see to them. So those were the softer issues. But the more harder political issues is that the women knew exactly what they wanted. And if you look at the Western Cape, the women was very central in the political history of the Western Cape, both in the women's movement, both in the youth movement, and both in the civic movement. They were very central in that.